Hey everybody, talking a little bit more about does this patient have hallux limitus? Typically we're going to see that patients will report aching and throbbing on walking. They'll say that it might be a bit jarring through their big toe joint, and when we get an x-ray there may be an elevated first metatarsal. That joint may be squared off, or the first metatarsal head may be a bit more squared off. There might be joint space retained as we're seeing in this x-ray here, and there will be likely very minimal osteophytes that aren't significantly stopping the motion of that big toe joint. There is going to be range of motion when you're moving it up and down, and really checking, and that's going to be on your treatment table. Whereas if you put someone on the ground in their resting calcaneal stance position, you're unlikely to find that there will be good dorsiflexion of that big toe joint or the first metatarsophalangeal joint. Now, that will be corrected when we bring that into a neutral calcaneal stance position, and this is looking at that functional hallux limitus that we talk about. And you know, it's a really good diagnostic test because it's going to show you the difference between hallux limitus and potentially hallux rigidus, where there is later stage degeneration. Now, particularly for these type of patients, they don't like that pain. And so what they're going to do is toe off through a low gear propulsion, which is going to be through that second to fifth metatarsophalangeal joints. In some people, they will abduct the foot further and then roll out medially through that big toe joint. And we don't really want to see this either, but it's going to be a very clear sign that something's happening at that big toe joint. But we're going to talk a little bit more about some of those other conditions in another video that it could be. So for the moment, hit subscribe, check out some of our other videos, and we'll see you on the next session. Cheers.